Good afternoon, those of you who've joined the webinar. We're going to give just a couple of minutes to see if a few others arrive. So maybe just hang tight 2 or 3 minutes, and then we'll get started. All right, well, it's 3 after. So even a small group, but we'll go ahead and get started. So everyone can have the rest of their afternoon. We get done by about 1:30. So for those of you who have not been to one of these webinars, just thought I'd give myself a brief introduction. My name is Scott Eiselt, VP of IMC for clinical operations. And IMC stands for Integrated Musculoskeletal Care. So we provide musculoskeletal services that range for people that have back pain, hip pain, neck pain, any joint ailment, or muscle or nerve issues. And so we'll get into some of those benefits towards the end of the presentation, but your employer probably has an offering of our where you can use our services. So we'll discuss that briefly at the end as far as if you do have a need, how to get in touch with us and what that would look for. But the primary focus of today's webinar is to discuss hip pain and what we can do to prevent it. And if we do have hip pain, what are some things we can try to potentially self-care? And then if that isn't of value, then where do we start as far as receiving care? So we'll start by talking just briefly about facts about our hip. We'll dive into a little bit of an anatomy lesson just so we're all on the same page there. And then we'll talk specific hip pain prevention strategies. And then last but not least, like I just said, we'll discuss care options if they're needed. All right. So just some kind of facts and myths I thought we'd get off the table here. So as far as age is concerned, I think there's a thought that our joints as we get older are going to stiffen, and we're likely to then have whether it be arthritic changes or need a hip replacement. And although age, we've seen as we get older, all right, musculoskeletal problems are an increasing factor in some cases. It is not a limiting factor to us being able to either prevent or resolve hip issues. All right, so just because we get later into life, it doesn't mean that we're destined to have a problem or that problem can't go away. All right. I'll use the term an object that once in motion stays in motion, and so if we continue to move our joints and use our joints, they tend to stay healthy with a high amount of vitality. All right. So age is sometimes a factor, like I said, in terms of the speed at which we can resolve a problem. And there are the occasional age-related changes that happen to be the root cause of a problem, but those are the exception, not the rule. All right. Second point would be degenerative changes in a joint or arthritic changes. All right. These are similar to like gray hair on our head. They're part of the aging process, and that our joints are going to demonstrate degenerative changes and arthritic changes as we age. All right. Some of that is, a part of the aging process. However, arthritic changes in a joint don't necessarily mean that joint is painful and doesn't work properly. All right. So there are what we call asymptomatic changes that can occur. So that are changes in a joint that we can see on an x-ray or what have you, that even though they're there, they're not painful, they're not limiting. All right. And so the presence of arthritis does not mean that we can't get better or that we need a total hip replacement, or that we're going to continue to worsen over time. Right. There are cases where arthritis is the root cause, and then that changes the treatment options to some degree. But often it's a contributing factor, not the factor as well. All right. The third bullet point up here, repetition in prolonged positions. All right. These are often the root cause of a lot of our joint ailments, and that the cumulative effect of keeping our joints in the same position or moving them only in one direction or in a very patterned manner. All right. This often starts to cause stiffness in the directions that we don't move, or the opposing positions that we're not keeping our joints in, because we neglect the other parts of the joint that we're not using. All right. Injury events can occur, right? We can fall, or we can surprise our muscles and tendons with a stressful or strenuous activity and cause an injury in that moment. All right. But those are not as common as, I'm not really sure why my hip started to bother me. It just did. Often it's the kind of pattern and repetitive things that we do in our life. And so those things are often easy to interrupt, and adding a few new patterns to our life can reduce or prevent the chances of those becoming the reason for a joint problem. All right, so we're going to dive into those a little bit later. Fourth point, rapidly changeable and reversible. So it's not well understood across the industry. However, the majority of joint ailments are actually quite rapidly changeable. Okay, and so that means with the right movements or the needed movements are applied to a joint, even if a joint is not working properly, it can rapidly change. Now, rapid in terms of this, in this instance, would be you could reverse a problem in a matter of weeks. All right, I like to tell patients that this could, that your problem could fall in a category that can change and improve in a matter of days to weeks. You can have more slowly changing problems that require healing and movement and other things that are more like weeks to months. And you can have problems that unfortunately can't change with movement. Okay. But the majority of them fall in that rapidly changeable category, which is great, for those that might be suffering from a joint problem. Moving on to the last two, inflammation. Okay. Inflammation gets somewhat a bad rap or a bad reputation, within our kind of healthcare culture. We have a lot of medicines and things that are anti-inflammatory based. Inflammation in and of itself, if it's present because there is an injury, all right. So often after we have an injury, inflammation is present, typically 3 to 5 days at the most, sometimes up to 2 weeks. But that is our body's initial process or the building blocks of the health of the healing system. All right. How we heal. So without it, we wouldn't heal properly. All right. So inflammation is very healthy. It's just not supposed to stick around. Okay. And so often inflammation has what we would call a mechanical source. All right. So the joint's not working properly, or there's some other reason as to why the body is staying inflamed. And that's why you hear someone who takes an anti-inflammatory, or let's say someone has an anti-inflammatory injection into their hip. and you hear a little bit of a scattered or varied response. You get some people who are like, hey, yeah, I had an injection and my hip pain's been gone and hadn't come back. And then you hear people who say like, hey, I had one and it helped for a couple months and then it wore off. And then you have some people say, well, I had one and it didn't do anything. And the reason for that varied response is that in the group where the problem went away entirely, it's safe to say that their problem was an inflammation-based problem because there's an anti-inflammatory treatment, got rid of that inflammatory pain. The other two likely have a mechanical source, which is why the injection didn't resolve the problem. All right, so it temporarily took away a part of the problem in the middle instance, or didn't get to the problem at all in the last instance. All right, so inflammation is approximately less than 5% of all hip issues. All right, not the leading reason why our hip might hurt. And last but not least, surgery. Okay, it's an option and it's a necessary intervention for some people. All right, but that too is only in like the 3 to 5% of the population. Okay, and that there are a lot of things we can do with movement and exercise and positions that can either resolve most problems or help us manage so we don't have to go down that invasive pathway of surgery unless we absolutely need it. Okay, so like I said, it's necessary in some instances, but it's important to exhaust our other options before we pull that invasive lever, because it comes with it a lot of other variables and factors. All right, there's a lot going there. So dive into more kind of the hip anatomy, how it works. All right, we can basic overview. On the left side of here, so it would be the right side of that body, but our left, you see the bones of the hip. So the hip is a true ball and socket joint. All right, so the femur is the ball portion and the pelvis is the socket portion. All right, that type of joint allows for a lot of freedom of movement. Okay, so that means it can move in a lot of different directions. Second to only the shoulder in terms of all the different directions it can go in and how much we can move it. All right. Now, those bones that are connected and supported by what you don't see here is a series of ligaments that go bone to bone and attach and support that joint and hold it in place. Okay. They are what keep that joint from moving too far. All right. They can get, in some instances, if we don't move into certain directions, they can become shortened in length. And then therefore our hip becomes stiffer or less mobile because we fail to stretch or use the length of those ligaments. All right. On the right side of the screen, you see the muscles that are around that joint, and they are tasked with moving the hip in the different directions, helping us walk, go upstairs, run, lift our leg, to put our pants on, all those things. Okay. Muscles, all right, they can be injured if we surprise them with activity that's too difficult. They can weaken due to disuse. All right, so if we fail to challenge them, and then when we do challenge them, they can hurt. All right, and they can also shorten in length if we don't elongate them on a regular basis because we hold them in the same position all the time. All right, and so that's kind of how that joint system works in a nutshell. All right. As far as how can we contribute to a healthy hip joint, I touched on it there, but just not with these words, but living an active lifestyle, using our joints, using our ligaments, muscles, and tendons helps keep them with a certain ability level, so that when we want to use them, they're not surprised by our activity. They don't limit us because we've been doing things with them on a regular basis. All right, that helps us with the second thing, which is maintaining our range of motion and flexibility. We're going to look at two particular movements today meant to move our hip and low back into directions that we rarely take them. Therefore, they often get stiff and cause us to lose our range of motion and flexibility. All right, so we're going to work on that one. And we're going to move both of them into what's called end range joint movement. All right, we need to take our joint to its limits on a regular basis. If we do that, we maintain the movement ability of that joint. It's when we start limiting how far we move that joint that we start to then change and neglect those tissues that allow us to do that, they start to shorten, like I said, or we even can get bony changes where the joint changes its surface, doesn't allow those movements. All right. Strengthening program, I think we've all heard about the benefits of doing some amount of strength training, even more so as we get older, and we tend to lose skeletal muscle as we get older. Some of that's due to because we don't challenge those muscles, and also some of it's because as we get older, it gets harder to build and maintain skeletal muscle. All right. Lastly, we touched on repetition and prolonged positions. We'll talk about how to interrupt those, but I won't belabor that anymore. And then the very last one, addressing painful impairments. All right. So when something's hurting, our body has an amazing ability to repair itself and restore functionality without us doing anything oftentimes. Okay. However, we can't take that for granted, or sometimes we'll be left with a painful impairment that's not getting better, and it can start to then become chronic and get harder and harder to change. All right. So one guideline that I would recommend is that is a 2-week rule. So if something starts bothering you, give your body up to 2 weeks, as long as it's not worsening, to see if it can start to improve on its own. If in a matter of 10 to 14 days, you start noticing that it's not so bad, it's improving, that gives you another 10 to 14 days to keep monitoring it. But if it plateaus, then you're going to want to get that looked at. All right. Because if your body can correct itself, it will become fairly obvious that it's doing so without you intervening or getting some sort of treatment. But if it isn't, the longer you let a problem remain there, the harder it is in some cases to change it. All right. All right. So sources of hip pain. All right. So the obvious ones are the hip joint, the ligaments around the hip, or the muscles and tendons that control the movement of the hip. We touched on those. The less obvious ones that I wanted to point towards is actually the low back, which is where the nerves that control our hip are housed. Okay. There is an extremely strong relationship between our low back and our hip. All right. And the 71% that I'm showing on the body is a number that was found in a study where they looked at people with standalone hip pain. So the patients had hip pain only, no back pain, and they put people through an assessment and treatment. And 71% of the individuals who had hip pain resolved their hip pain by moving their back only. They didn't move the hip at all. All right. And so in this particular study, that tells us that, hey, there are cases where our hip hurts. All right. Our back doesn't, but the source can be our back. So any preventative strategy, which we're going to talk about today, has to include how do we also prevent low back pain? Because if we can keep our low back healthy, that's going to reduce a high percentage of hip problems. And we can then work on our hip. We're going to have a much lower likelihood of having a hip problem, or hip pain, I should say. All right, just touched on these. I'll go into a little more detail. Talked about spinal source. So we have to include the low back in terms of anything we do preventative-wise. The second piece is the joint source. Okay, we talked about rapidly changeable problems. It's more than 60% of all hip problems. Okay, these require movement. All right, and oftentimes it's movement in directions we don't typically go in our normal daily life. All right. These problems often resolve within a matter of days to weeks if given the right movement. All right. So that could be through self-care if you use some of the tips we give you here, or through one of our clinicians if you're unable to resolve it on your own with self-care. A soft tissue source. The soft tissues around the joint. We talked about being muscles, tendons, and ligaments. All right. They can be injured by an event, or they can change slowly due to neglect and us not using them. But these can be conditioned or remodeled or kind of adapted back to a healthier state. All right. But it takes our body weeks to months in order to do that. And they need regular purposeful movement and exercise. Okay. But that's a very common thing, but it's very reversible in nature. And last but not least are what I would call the other sources, things that movement isn't necessarily going to resolve. Inflammation, we talked about that, needs an anti-inflammatory treatment. Prescription medication, over-the-counter medication, injections. We're not here to talk about that, but that's the type of treatment for that problem. Structural issues, this could be an arthritic problem or things of that nature. Sometimes those need surgery, all right? Other times they need movement-based care to help someone manage the problem in that they don't want to have surgery or they're not a candidate, but hey, we can't change the structure, but we can find ways to adapt what we do and use the joint and keep it healthy to where we are now. All right. Okay, so we're gonna dive into some prevention. All right. If you were on the webinar earlier this year, we talked about low back and keeping it healthy. Bending backwards or doing this press up movement is the most preventative low back movement. And the reason for that is because we often sit and bend forward. All right. So the average North American puts their low back in a forward bent position up to 3,000 times a day. All right. So moving it the opposite direction and maintaining that, all right, can help prevent that presentation. So I'm going to show you just kind of, if you watch the screen, the appropriate way to do that. So it's repetitive and rhythmical in nature. All right. If you prefer to do it standing, all right, you can do it against a countertop to make sure you go as far as possible without balance being an issue. You can see how to do that as well. All right, so that's the low back side. Right. As far as the hip is concerned, our hip does a lot of what our back does. So often our hip is flexed or bent up in front of us. And the reason for that is we're sitting, probably more times than not, either in a car or at a desk or on the couch or recliner. All right, so our hips are in that flexed position. Okay. And when we walk, we also are flexing our hip, and it doesn't move behind us very far. Okay. So moving the hip backwards, which you can kind of see here, so the knee, the one that's being stretched, and I'll show you the video in a second, is the one that's taking the work. Okay, so moving our hip backwards in what's called hip extension helps maintain the joint mobility to go there. All right, and since we don't go there in our daily life, often this becomes stiff and the joint starts to then malfunction. Okay, and so the way you do this, you kneel. Often I say do it on a pillow or towel, more comfortable on the knee. Okay, and you just kind of push your hips forward, keeping your torso straight up and down. All right, I'll show you that one more time. Couple second hold, and then you back off. And you would do this, 8 to 10 repetitions. Instead of holding it for, say, 30 seconds or a minute, you hold it for 2 or 3 seconds and you do a number of them in a row. And I would do that on both sides. Okay. Right. So that is going to be a movement that I would recommend that you do from a preventative perspective. If you work at a desk, you could do it daily. You can stand or kneel at your desk or do it in the morning when you're putting your shoes and socks on, right? Just, creating a habit of it. If you have a particular problem, all right, so if you drop down to the third bullet point here, you know what, my hip's been bothering me. Okay, well, I would try the low back exercise first to see whether or not it had an impact. If it's helpful, then you're going to do the low back exercise 8 to 10 times, 4 or 5 times a day, and expect that to start getting better within a matter of a few days. If moving your low back doesn't seem to have an impact on your hip, then you do the hip one. All right, same thing though, every few hours, all right, 8 to 10 times throughout the day, should start to then result in changes of their pain or impairment or whatever it is you're struggling with. Okay. I would expect changes to be fairly rapid in most cases because of what we talked about earlier. Over 60% of hip problems are rapidly changeable. Okay. If it falls into one of those more slowly changeable groups, you're not going to see continued improvement. And that's where then you're going to want to reach out and see somebody for a kind of more robust evaluation and maybe get some other treatment or interventions. All right, there's 2 ways you can do that. The first way is through the IMC Joint Strong web app, and I'll give you the web list in a minute, or the website. But this would allow you to then self-assess your problem. So you go in there, you can tell the application essentially what you're dealing with. And then it'll have you test your problem. So test your own hip, for instance. And then based on the results that you tell it while you're testing yourself, it will give you a personalized treatment plan. And then it'll have you check back in with it very much like physical therapist, if you will, that would be having you check back in with it. All right. And if you're able to self-correct, well, then it'll guide you through the treatment process to resolution. If based on what you're telling it, you plateau or you're not resolving or the self-treatment tools are not effective, then it's going to recommend that you see one of our clinicians or an in-person clinician. Okay. For that, we have two options if we're within your health network. Number one would be if we have an in-person clinic, we have those in a variety of places around the country. Otherwise, our largest footprint is actually our telehealth footprint. So we provide virtual care in 49 states across the country. All right. And so telehealth has actually been shown to be equally as effective as in-person care, because many of the things you need to resolve are self-driven strategies. You don't need necessarily someone to put their hands on you in all circumstances. You need to be shown what to do to care for yourself. And that's easy to do through a computer screen or smartphone or what have you. Okay, so a really, really good option for those of you that are anywhere across the country. This is just showing, just real briefly, on the left here, these are outcomes from our in-clinic sites, and these are outcomes in the darker blue of our telehealth clinics. All right, and all of our clinicians are trained the same in our organization, whether you're in a clinic or doing telehealth. And so you can see our overall improvement numbers are actually a little better. Telehealth pain reduction is very similar, and overall satisfaction also very similar. All right, so a viable option if you need it. And I mentioned the in-person, that's just going to be location specific depending on where you live, if that's the case. All right, here is that web app address. All right, so this within the web app, you have a preventative platform. So you can click on any joint and it can demonstrate some of the stretches and activities I showed you here today. But it goes joint by joint. So you can select, low back or neck or shoulder and kind of learn more about that joint system and what it is you should do to prevent problems there. And then it also has that self-care portal, which is where you would tell it what your problem is, and it'll give you an evaluation that you can perform on your own to see if you can resolve your issue without formal care. All right. So I know there's only a few of us on the call, but this is an opportunity. We got a couple minutes. If there's any questions, feel free to put them in the chat if you'd like, and I can speak to those. Or if you'd rather take yourself off mute, you can do that as well. So Nick, I don't know if there's any, I can't see the chat for my screen, but I don't know if there's anything in the chat.
I don't think so. Nope, doesn't look like anything in the chat right now.
Perfect. Well, that being said, those of you who attended, thank you for taking time out of your day, learning a little bit about the hip. If you need something, our contact information is also within the web app, so you can go to app.jointtraining.com and see where you can phone or email us with any questions. But hope you took something from that. Have a great rest of your week and be well.